predisposing, enabling, and need analysis on kinship childcare. Hello, my name is Yong. I'm a PhD student in genetics and genomics, and I am also pursuing an PhD degree in policy and management. I'd like to talk about the potential health vulnerability for kinship childcare. The children from the kinship care are an undeserved and vulnerable population for proper healthcare access, especially mental and behavioral healthcare. I will first introduce the special population in kinship care, describe the predisposing, enabling, and need characteristics of kinship care vulnerability to understand the potential risk of kinship care population, and finally propose questions for class involvement. Introduction of kinship care special population. The kinship caregivers, for example, grandparents, aunts, uncles, cousins, serve as assistants to the parents who are unable to fulfill their foster role. As a matter of fact, kin are the primary caregivers for a large population of children, and the number of children living with relatives has increased significantly for the past 2 decades. In 1990s, about 2.3 million children lived with relatives without a parent present in the home. Over 3/4 of these children were in private kinship care. However, when we compare traditional care and kinship care, children in kinship care were more likely lived in low-income households and had fewer opportunity to get appropriate child welfare and health care services. Moreover, because of high rates of behavioral problems among kinship care children, there have been concerns about kinship caregivers for lack of resources to meet the needs of children with behavioral problems. So improving kinship care is important, because children with a mental problem history can lead not only just to the burdens of their parents, but also to risky behaviors in adulthood, such as depression, alcoholism, violence, and suicide. Therefore, it is necessary to develop theoretical mechanisms to understand services use of kinship caregivers. Then I will describe the predisposing, enabling, and need characteristics of kinship care. So to understand the potential risk of kinship care population, predisposing factors. Predisposing factors are the factors may have impact on person's predispositions to use these healthcare services. Caregiver age is a predictor of caregivers' services use. Usually, kin caregivers are older than non-kin caregivers and tend to be poor and live with limited incomes. There is a consistent link between race, ethnicity, and child caregivers' service use. The consideration of race ethnicity of child giver is significant to understand child health outcomes, because kinship caregivers may face educational, cultural, and semantic barriers to proper childcare. For example, caregiver high education level was associated with more engagement in preventive services for child mental health. Caregivers' belief is also an important predisposing factor about caregiving and social healthcare services. Enabling factors. Enabling factors are the factors that either promote or inhibit service use. Kinship caregivers encountered various problems, such as finding medical care and experienced financial stress. In addition to financial assistance, kinship caregivers had a number of service needs, including help to receive appropriate education, assistance in finding available supports, and advocacy for legal processes. Such factors can be identified to promote kinship caregivers' access to the needed healthcare services. Another, child welfare involvement can make kinship caregivers access to the necessary resources. Kinship caregivers who were enrolled in the child welfare had greater access to proper healthcare and were more likely to be covered by Medicaid. Need. Need is the evaluated need for the healthcare services. Mental health care needs among children and their caregivers are essential in kinship childcare. About 22% use in kinship care demonstrated a mental health need. Approximately 38% of this use had an unmet educational need. Further, kinship care children more frequently received a diagnostic of either disruptive behavior problem or mood disorders. Kinship caregivers' psychological functioning is also a need factor. It might serve as a predisposing factor also for children's mental health care. Caregivers' psychological functioning has a moderate effect on the relationship between children's mental health needs and mental health care. Above, I dissect the population in kinship care from the predisposing, enabling, and need aspect of vulnerability framework. The kinship care children are underserved and vulnerable for proper health care access and satisfied health care. This may cause children's unmet medical care, mental issues, and social behavioral problems. I may bring up several questions for further thinking. The first, how can cultural factors such as race, ethnicity have impact on the use of formal health care services among the kinship care population? The second, what should the child welfare policymaker do to increase coverage in medical care and to decrease behavioral problems for foster children? The third, what is the implementation for children's welfare policymakers to address those vulnerability factors in kinship care, such as caregivers' age or racial disparity, etc.?